Acute pancreatitis causes, symptoms, diagnosis, and treatment. Acute pancreatitis is a sudden inflammation of the pancreas that can cause serious damage to the pancreas and surrounding organs. 1. Causes of acute pancreatitis. Acute pancreatitis can be caused by a variety of factors, the most common of which include 1. Causes of acute pancreatitis. Gallstones. This is the most common cause of acute pancreatitis, accounting for about 4,050 of cases. Gallstones can become lodged in the common bile duct, blocking the flow of bile, leading to increased pressure in the bile duct and causing pancreatitis. 1. Causes of acute pancreatitis. Alcohol abuse. Alcohol is a major factor in acute pancreatitis. Long-term alcohol abuse can damage the pancreas, increasing the risk of acute pancreatitis. High blood lipids. Elevated levels of fat in the blood can block small bile ducts in the pancreas, leading to inflammation. 1. Causes of acute pancreatitis. Cholecystitis. Cholecystitis. Inflammation of the gallbladder can spread to the pancreas and cause acute pancreatitis. Common bile duct obstruction. Obstruction of the common bile duct due to causes such as cancer, stones, or parasites can lead to acute pancreatitis. 1. Causes of acute pancreatitis. Pancreatic diseases. Certain pancreatic diseases such as cancer, cysts, and chronic pancreatitis can also cause acute pancreatitis. Medications. Some medications such as furosemide, sulfonamides, 6-MP, estrogen, and ethanol can cause acute pancreatitis. 1. Causes of acute pancreatitis. Other medical conditions. Other medical conditions such as cardiovascular disease, lung disease, endocrine disease, and autoimmune disease can also contribute to acute pancreatitis. 2. Symptoms of acute pancreatitis. Symptoms of acute pancreatitis can vary depending on the severity of the disease. Common symptoms include severe upper abdominal pain that radiates to the back. Pain usually comes on suddenly and gradually gets worse. Nausea and vomiting. Fever. Abdominal distension. Rapid heart rate. 2. Symptoms of acute pancreatitis. Cold sweats. Low blood pressure. Jaundice. Yellowing of the skin. 3. Diagnosis of acute pancreatitis. Clinical examination. The doctor will ask the patient about their medical history, symptoms, and examine their abdomen. Blood tests. Blood tests will show elevated levels of amylase and lipase, which are enzymes specific to the pancreas. 3. Diagnosis of acute pancreatitis. Imaging tests. Imaging tests help to determine the location and extent of pancreatic damage. 4. Imaging tests for diagnosing acute pancreatitis. Ultrasound. Ultrasound is a simple, non-invasive technique that can help detect abnormalities in the shape of the pancreas. 4. Imaging tests for diagnosing acute pancreatitis. Computed tomography. CT scan. CT scans are the most common imaging technique used to diagnose acute pancreatitis. CT scans help to assess the severity of inflammation, damage, and necrosis of the pancreas, as well as detect complications such as abscesses, pancreatic fluid collections, and intra-abdominal bleeding. 4. Imaging tests for diagnosing acute pancreatitis. Magnetic resonance imaging. MRI. MRI can help to identify the detailed structure of the pancreas but is less common than CT scans in the diagnosis of acute pancreatitis. Endoscopy. Endoscopy is used to evaluate abnormalities in the biliary tract that may be causing acute pancreatitis. Supportive treatment. Fasting. This helps to reduce the workload on the pancreas. Fluid replacement. This replaces water and electrolytes lost through vomiting and diarrhea. Pain relief. Pain medications are used to control pain. Treatment of the cause. If due to gallstones, endoscopic stone removal or surgery to remove gallstones. If due to alcohol, completely stop drinking alcohol. If due to medications, stop using medications that cause pancreatitis. Treatment of complications. If there is an infection, treatment with antibiotics. If there is necrosis, surgery or medical treatment. 6. Complications of acute pancreatitis. Pancreatic necrosis. The pancreatic tissue dies, which can lead to infection. Pancreatic fluid collection. Pancreatic fluid leaks into the abdomen, causing peritonitis. Intra-abdominal bleeding. Bleeding due to damage to blood vessels in the pancreas. 6. Complications of acute pancreatitis. Respiratory failure due to pancreatic fluid leaking into the pleural space. Kidney failure due to kidney damage from pancreatic fluid and toxins. Multiple organ failure due to damage to multiple organs in the body. Note: acute pancreatitis is a serious condition that requires prompt diagnosis and treatment. If you suspect that you have acute pancreatitis, seek medical attention immediately. A healthy diet, avoiding alcohol abuse, and managing chronic medical conditions can help reduce the risk of acute pancreatitis. Additional information: some cases of acute pancreatitis may be due to an unknown cause, which is called idiopathic acute pancreatitis. Acute pancreatitis can lead to chronic pancreatitis if it is not treated promptly. Chronic pancreatitis can cause serious complications such as malnutrition, diabetes, and pancreatic cancer. Advice: see your doctor for advice on how to prevent acute pancreatitis. Follow your doctor's instructions regarding diet and lifestyle to manage your condition effectively. Monitor your health, especially if you have any unusual symptoms.